Good afternoon to everyone, and welcome once again to Peter McCullough, who has kindly accepted an interview to address some of the points that were addressed by President Macron last night in his speech. He made several points about the epidemic and the pandemic, and we thought it makes sense to have somebody outside of France to react to each of those points in order to address them one by one. And first of all, verify those points and complete those points if need be, especially on the vaccination and the implication. Let me remind everyone that President Macron last night made mandatory vaccination for the healthcare workers, imposed the vaccination pass on a number of individuals, and which led to the prevention of access to a number of essential commercial shops, such as commercial centers, to non-vaccinated person. And in addition to this, he also mentioned that a healthcare worker had to be vaccinated by the 15th of September. That triggered a wave of reaction. And we thought, rather than boiling the ocean, we thought we might ask one of the world experts who spoke to the US Senate about the disease. And so welcome again to Peter McCullough. Peter, thanks a lot for giving us some of your time today. We have prepared a short presentation, and I'm going to share that with you, Peter, so that you can react to each of those points that we have just mentioned. So as Peter, can you see okay?
Yes.
Okay, so there are 2 pages, and here what we've done is we have taken each of the assertions of our French president. The first, and we would like for you to react to it. The first one is that the Delta variant is 3 times more contagious than the first strain, and it's spreading to all areas not covered by vaccination. Based on your experience, both as a doctor, as a professor, and in the US, what would you say about this assertion?
Yeah, so as a professor of medicine, internist, cardiologist, and epidemiologist, I'm completely focused on this pandemic response for the last year. So I've been like a laser on the data. The Delta variant came out of India, and it has 7 mutations in the spike protein, one in one of the other components of the virus. And in the test tube, it's slightly more contagious when tested compared to the original Alpha or UK variant, slightly more contagious in the test tube. It is not more contagious in the community. This is very important. France, just like many places in the United States, has hit herd immunity. So the virus can't pass as readily as it could a year ago. And so no, it's not 3 times more contagious. Even any data that come with respect to contagiousness of the new strains is done in a test tube, and so it's theoretical.
Thanks, Peter, for that. So the second assertion that derives from the speech is, if we don't act now, the number of cases will continue to rise sharply and will inevitably increase hospitalization starting in August.
Well, there is a rise in cases, and in France, you have a rise from very low baseline, just like we have in the United States. It's also occurring in Japan and elsewhere in the world, but from a very low baseline. And it's because the Delta, as well as the Lambda and Alpha, are resistant to the vaccine. So it's both vaccinated and unvaccinated patients can get these new strains. The vaccine has no effect against them. The vaccine simply is obsolete at this point in time. Fortunately, these newer strains are mild, and it's very easily treated. They have the lowest of all mortality rates compared to the original, certainly the Wuhan spike protein, the original wild type virus, as well as the UK variant. So yes, there'll be a rise in cases, but vaccinated patients are contributing just as much as unvaccinated patients because the vaccine doesn't work against new variants.
Then moving to the next one is the statement he made was, all the vaccines available in France protect us solidly against this Delta variant. They divide by 12 its power of contamination and avoid 95% of the serious forms. Just so that I mentioned, there's no scientific evidence in his speech. This is just the statement he made, okay?
Well, we have to quote the sources of the data. So the June 25th, 17th issue of the variants of concern from the United Kingdom has over 90,000 patients with genotyping for the virus. So they know in 90,000 infections that are brought to attention. So these are kind of moderate or more infections that are brought to attention in the UK. We know for Delta, as an example, 42% have been fully vaccinated. So the vaccine does not work against Delta. It's very, very important. A recent paper in Science concerning the Lambda variant coming out of California, same thing, vaccine has no effect. There's been a recent paper regarding the neutralization ability of the antibodies in the New England Journal of Medicine against the Delta and newer variants. It doesn't work. So the virus has outsmarted the vaccines. Remember, the vaccines were all coded and keyed against the original Wuhan wild type virus. That's long gone. The newer variants have basically escaped the vaccination, and there's no reason to undergo vaccination now because the vaccines don't work.
So, so in essence, what you're saying is that we should ask him to provide the evidence of the statement of the division by 12 of its power of contamination, because based on what you're saying, really, that doesn't sound to be correct.
Well, if the UK has 42% of 90,000 Delta cases have been vaccinated, that you'd have to kind of explain what's going on. The only explanation is the vaccine doesn't work or only works partially. It's simply not compelling enough to undergo vaccination at this point in time, given the safety concerns.
And in your experience, did you see any data that would be compelling to state that the vaccination avoid 95% of the serious form?
Well, there's no more serious forms. The rates of mortality, for instance, in Delta in the UK report, again, that's one of the best sources of data, is 0.8%. It's far lower than the 1.9% of the Alpha or UK variant. UK variant was much milder than the original Wuhan variant. So all cases are mild right now. The vaccine has no impact on the severity of cases. Fortunately, Delta is mild for everybody, whether they've been vaccinated or not.
Okay, thanks, Peter, for that. So now if we move to the last point on this page, he basically stated that vaccination is the only way to return to normal life.
It's not true. In United States, overall, we're at about 48% that have taken the vaccine. 52% haven't taken it, largely because of the concerns over safety. We've had record mortality and hospitalization that occurs shortly after the vaccine. And most Americans now just think the vaccines aren't safe enough for clinical use. There is a report from the evidence-based consulting group, that's the lead consulting firm to the World Health Organization, a report that's gone into the MHRA in England, basically concluding that the vaccines that you're using in Europe are not safe for human use. So no, the vaccines can't be the pathway back to normal life because they're not safe enough to use in human populations, and they don't work well enough. And I can tell you in the United States, we're back to normal life without the vaccine. And so we're just like in France, we're going to have a small rise in cases. And the cases are heavily influenced by the asymptomatic testing. The World Health Organization, as of June 25th, basically told the world to stop doing asymptomatic testing. You're still doing a lot of that in France as well as the United States. And so we know the case count is inflated by at least 40% just from asymptomatic false positive testing. So if we got away from false positive testing, just took care of sick patients with early treatment, it's a mild set of variants now, and the pandemic will close out with vaccination. It's not needed to return to normal life.
If we move to the next page, and which is the last one, the starting point is that the first vaccinated people will soon see their antibody level drop, their immunity decrease. Have you observed this from your a scientific point of view?
That's not true. There's been studies, even when the antibodies are completely gone, studies from the bone marrow showing that the plasma cells are ready to respond if the body's re-challenged with SARS-CoV-2. So the natural immunity, the T cell immunity, is robust, durable, and complete. We expect it to last for decades, just like it did with SARS-CoV-1. So the naturally immune will have a robust immunity, and that will confer your herd immunity. We're hopeful that those who are vaccinated have some residual T cell recognition. But having said that, you've had continued infections despite vaccination in France, just like we did in the United States, and you've built enough herd immunity to close it out with any further vaccination.
So when you move to the next statement, which is future variants, so we do anticipate you have other variants than the Delta one, could be even more dangerous than the Delta variant. Would that be a fair statement or normal for a virus of this nature?
No, as the virus mutates, it gets progressively less virulent or less dangerous. So I've mentioned the Delta, the Lambda variants, and the Epsilon variants. They're actually weaker viruses. They're less virulent, they're less dangerous, and they're coming about because of mass vaccination. So a report from Acevedo in South America from Peru is very clear that the Lambda variant is coming out of South Africa because of vaccination. In a paper from Boston and the Mayo Clinic here in the United States from Neeson and colleagues have shown among vaccinated populations that there's less genetic diversity. And so we're seeing these relatively more dominant strains. So for instance, your dominant strain will emerge in Europe as it is in the United States as being Delta. Fortunately, it's weaker. And then after that will become the Lambda and the Epsilon, almost certainly because of these evolutionary pressures that vaccination is putting on. But they're definitely not more dangerous. They'll become proportionally greater in the population, though.
So his next statement was really that he declared that to end the pandemic permanently, we must vaccinate everywhere, everybody vaccinate the world. So obviously there are a few words here: to end the pandemic permanently, and we must vaccinate everywhere. So maybe your point of view on these two items?
Well, remember the coronavirus is from a family of common colds, and all of us get somewhere around 4 colds per year or upper respiratory tract infections. So we won't get to 0 cases of this. This will basically degenerate into a form of the common cold. That's what's happening right now. It'll be indistinguishable from the next upper respiratory infection. We won't get to 0 cases, and that won't happen worldwide because there's countries that are simply not having any vaccination whatsoever. And there's other countries with great concern over vaccine safety. An example is Japan. Japan has a large elderly population, and they only have about an 18% vaccination rate because they don't think the vaccines are safe enough for use. And so I think the lack of efficacy, the lack of safety with the vaccines is really going to limit their use. And at this point in time, we can begin to close down the vaccine program and just treat serious cases and have this virus degenerate into the family of common colds.
And if we move to his last statement, is he basically told last year that we would have to live with the virus. This will be the case throughout this year, 2021, and probably for 7 months in 2022, even if the vaccine changes a lot of things. So his view is that we have to vaccinate everyone, we have to live with the virus. What will be?
Well, those two statements are contradictory. So I think the French audience would wonder about those basically contradictory statements. Yes, you will have to live with the virus, but it's going to be like the common cold. It's going to be very treatable. We're finding that sometimes patients need no treatment now, and some patients who have some respiratory symptoms need very mild inhaled steroid inhaler like budesonide, oral steroids, aspirin, and then in some cases anticoagulants in elderly individuals. It's been shown now by Barentios, as well as by Chetty in South Africa. This can be treated without hydroxychloroquine or ivermectin, so we don't have to use controversial drugs the French may have concerns over. We can use simple medications to get patients through the illness. And it's really now going to become part of a family of common colds.
So altogether, these were the scientific assertions that he made. Obviously, you've said no to quite a few of them. Out of that, his conclusions were that we had to vaccinate compulsorily or mandatorily all the healthcare worker. What do you think about this position? Do you think it's reasonable?
Well, we've had no major healthcare system outbreaks from the beginning of the pandemic. So the hospitals and the clinics are the safest places of all because there's care and concern taken. And people know nowadays not to go into work if they're sick. Remember, the virus can only be transmitted if someone has a fever and who's sick. The virus is not transmitted asymptomatically. So as long as healthcare workers, when they're sick, have a reasonable program of staying home and having substitute workers go in, there won't be any hospital spread. There has never been any major hospital outbreaks. The only place in healthcare where there has been outbreaks has been in nursing homes. And it may be reasonable for nursing home workers to take some special precautions, and then high-risk nursing home workers to potentially consider vaccination. Let's say those over age 50 with multiple medical problems. But that would be it. Now, this isn't the end for vaccination. There could be safer vaccines coming. I've mentioned that Pfizer, Moderna, AstraZeneca, and Johnson & Johnson all have serious safety warnings. There's been thousands of deaths and hospitalizations that occur immediately afterwards. The public doesn't consider them safe. However, we have heard good news from Novavax. Novavax has an antigen-based vaccine. It's about 5 micrograms of purified spike protein, no genetic manipulation, no genetic entry into cells. And it looks like it's just as good as Pfizer and Moderna. It's not perfect, but just as good and far safer. So if we get to an antigen-based vaccine, then I think many of the French could go along with Mr. Macron and the idea that vaccination could have a role provided it's safe. And it would have to be almost like a flu shot or a tetanus shot. It would have to be that safe. We can't have any more French die after the vaccine or become hospitalized or have terrible neurologic, cardiac, immunologic, or hematologic problems. It's simply not worth it at this point in time. The vaccines currently don't work enough and they're unsafe for use in France.
And so moving to I would say the controversial vaccination pass. So as a conclusion, he's made it mandatory, and for all the others, they have imposed starting August 1 vaccination pass. So in essence, it's an incentive for anybody else who's outside the healthcare worker category to get vaccinated in order to access bar, restaurants, shopping center. Have you seen the same sort of vaccination pass in the US? What's the status over there?
There's been discussions of vaccine passes, but many have just not put them forward because the vaccines don't work well enough to have a pass. So for instance, it was reported in Houston a week ago that there was a family wedding and they mandated that everybody get the vaccine to go to the family wedding. They got together, several dozen people, and 6 people came out of the wedding with the Delta variant. Again, because the vaccine doesn't cover Delta, and Delta is going to be the most prominent strain. So you can imagine a vaccine passport and people are on their privileged train rides or planes, and they just pass Delta back and forth to each other. The vaccines don't work well enough to have a passport. The only thing that's solid is natural immunity. Natural immunity confirmed with an illness confirmed by PCR, antigen, or sequence testing. If someone has a history, a solid history of COVID-19, they can't get it again. Natural immunity would be the only thing. Let's say in a high-risk activity in a congregate setting, if an official organization wanted to be extremely tight, they would only admit those with natural immunity. The vaccine immunity is too faulty, it's too porous, it doesn't work, and you can't build a vaccine passport on something scientifically that just isn't strong enough.
And so we've seen you sort of provide a testimony to the U.S. Senate, which was quite well prepared, I would say thorough. Would you be prepared to stand in front of the French Senate and the French National Assembly to have a debate around this and to provide and to share your knowledge?
Yeah, I'd be delighted. The French audience can, even by listening to me, hear me quote scientific studies, the first author, and what the major findings were. The only thing we can do is follow the science. And so I'm pinpoint on using scientific findings to guide public policy. And you can see all of those statements that you just read by your government officials. None of them were anchored in the science. None of them were evidence-based. And all of them were actually designed to promote mass vaccination with actually great harm to the French people. And so I think that the French, like any other country, ought to demand a team of experts that are using the literature, using peer review, using scientific principles to come up with recommendations, not medical dictators.
So moving to this piece of advice, I mean, what are the missing components in this, I would say, narrative? I've identified that, for example, the informed consent, the free and complete informed consent of individuals, because there's some scientific points which are missing. Would that be one of the first things that you would try to address?
Well, the informed consents in all the countries say right on the consent form that vaccination is voluntary. So it's very important. So if a French government now says a administration of a vaccine is mandatory, they actually have to change the consent form to say it's mandatory. Right now, the consent form says it's voluntary. So if a French citizen walked up to a vaccine center and was told they have to take the vaccine, the first thing they actually see is a consent form that says it's voluntary. That means walk away. You don't have to do it. It's voluntary. So everyone needs to know the vaccines are voluntary and that no one under any circumstances can receive pressure, coercion, or the threat of reprisal to take a voluntary vaccine that's still investigational. It's not proven to be effective, and it's been shown to be unsafe in all the data reporting systems. So one doesn't have to be forced into that. It violates what's called the principle of the Nuremberg Code. It also violates the Declaration of Helsinki. We can't have investigational products that are being used and then force individuals to take them and violate that important principle. It violates ethics. It violates basically morality. And from a civil perspective, it's illegal.
So you just mentioned sort of the side effects and the amount of side effects that you've had in the US. And that definitely is part of the informed consent, because if you talk about the benefit or the efficacy, then you should talk about the adverse effects. So just to remind the readers and the viewers, what are in your views the side effects and what size are the side effects?
Well, the consent form in the United States is very short, and it says that we don't know if the vaccines are going to work. They are investigational, and the side effects can be anything from a sore arm all the way to death. And that's what it says in the consent form. And boy, have we seen the deaths. So in the United States, we're over 9,000 deaths that have occurred. There's an analysis from Rose and colleagues that was published in the Journal of Science and Public Policy that shows that 50% of the deaths occur within 48 hours of the injection, and that 80% occur within a week. An analysis by McLachlan and colleagues from London shows that 86% of the deaths are directly related to the vaccine. So these are people who are well enough to walk into a vaccine center and die within a few days. I can tell you that's unacceptable. In the United States during the flu pandemic in 1976, we shut down the program after a quarter of Americans were vaccinated with 25 deaths. We shut down the program. A paper by Bruno and colleagues that has gone worldwide from 57 authors, 17 different countries, have said that if the countries do not have data safety monitoring boards, critical event committees, and ethics committees to ensure safety and to make modifications in the program, they should shut down the program. And so the French, like the Americans, have still yet to have a press briefing on comprehensive safety of the vaccine program. Your French authorities, instead of pushing the vaccine on healthcare workers and make it mandatory, they should actually fairly be presenting the safety information from the vaccine to your citizens. That's what they deserve. We're 6 months into the program, and we have still yet to have a press briefing on overall safety of the vaccine.
Peter, thanks a lot for all of this. If you had one closing statement to, I would say, my French colleagues, my French citizens, what would that be, apart from what you've just said?
I would focus on acutely sick patients with COVID-19. There's relatively few of them. You have a very low baseline. You're going to have a small rise with Delta. It's always manageable in the home with sequence multi-drug therapy. I've published the lead papers on that are in the National Library of Medicine. They are permanent and secure as publications. You can search me by McCullough in American Journal of Medicine and Reviews in Cardiovascular Medicine, and that it's treatable. One can get through the infection. We do not have to risk hospitalization and death. The new variants have rendered all the vaccines obsolete. There are multiple calls into regulatory agencies to go ahead and close the program. Not a single person needs to be vaccinated at this point in time, and certainly not healthcare workers.
Well, Peter McCullough, Professor McCullough, thank you very much for your time. It's very kind of you to give us some of your time so early in the morning from your point of view, so to provide our viewers a comprehensive review of the statements made by the French president last night, and to validate or counter-validate or invalidate some of his statements. Wish you a very good day, and thanks a lot for your time today.
Thanks for having me.